My world with the changes right now because of coronavirus is more of in a delay mode. You know, obviously the frontline folks are the emergency rooms and the primary care internal medicine docs that are seeing these patients, the nurses, the PAs, nurse practitioners, respiratory therapists, everyone else involved in that, being more involved in sports medicine and orthopedics. Certainly if there's emergent cases, we're available. We're still trying to see people that need to be seen, but we're trying to be judicious in how we're having exposures for people with all the stay-at-home orders. We're limiting people by age, in particular, unless there's truly a traumatic event. We're doing a lot more telemedicine visits, a lot more phone calls, trying to do the video calls when we can. You know, it's hard for somebody who's a sports medicine doc like I am, where we take care of a lot of younger athletes that have, you know, finite times of their life when they can play their sports. In the 4 years of high school, somebody gets hurt in, you know, January, February, but wants to be back for the fall sports. Right now, all of our surgeries are on hold. And if we've got something that's a 6-month recovery process, like for example an ACL reconstruction or something with a shoulder reconstruction, those folks may not be ready for the fall. And so you kind of watching as their frustration is there, and we all completely understand the priorities are absolutely correct, but it's hard not to see that. And I think the other area where we're really seeing it, and it hit me pretty hard having played college sports, you know, our college athletes that we're seeing, they're losing their senior year, and particular spring sports. Fall sports were okay, but spring sports, all of a sudden the season just came to an end. You know, whether it be a Monday, Tuesday, or Wednesday, and all of a sudden the rule came down, we're shutting down the seasons. These are folks that trained all 4 years to get to this point, and they've lost now that opportunity. Now there is some legislation within the NCAAs. They're talking about trying to return some eligibility for these athletes, but some may not want to, some may be ready to graduate, and they've got jobs lined up. And so you look at that, and it's frustrating for those kids, because you know they put so much time and energy into it. At the same time, everyone understands the priorities are right, and we have to do it.